It's going to be an exciting one. As always, we're going to plow down some interesting silos, let's say. We're going to talk about diabetes. We're going to talk about diabetes in a way that potentially you have not heard it talked about before. And we're going to talk about intermittent fasting and how intermittent fasting literally is a solution to diabetes. I know that's probably a little counterintuitive to what you've been taught, but most of us are taught that if we have a disease state, or we assume this, I assume this, so if I have something like diabetes, that I will have diabetes for the rest of my life, that I'm cursed, with diabetes. It will never get better, it will never correct. And my only solution is to go to, pharma and take my metformin or take my insulin depending on the severity of my diabetes. Well, that's just not true. That is not true, ladies and gentlemen. And if you have family members or if you are afflicted with diabetes, or you have family members that are afflicted with diabetes, then this is going to be some important information for you. It's self-correctable. That's the best news. So, and that's the really, really cool news. The other thing that's interesting about diabetes, and this is a little bit hard. I'm trying to kind of get you guys over this hump, let's say, that a lot of these disease states, let's put it this way. So it's sort of two sides of a coin. Any disease state that's associated with the Warburg effect, which is what cancer does. So cancer, cancer, we've all heard cancer mutates cells. Well, what does that look like? Well, it looks like something called the Warburg effect, okay? And so there's lots of diseases. Autism has a Warburg aspect, and it turns out diabetes has a Warburg aspect. So it's looking like, and again, this is well substantiated in research, so I don't even know that I need to say looking like. This is, let's say highly, highly probable with a low P, that bacteria are the cause of this situation. So if a cell is in Warburg, unless you will put cells in Warburg yourself and they're trying to proliferate, but then they come out of Warburg and they come back to normal. If they stay in Warburg and get stuck in Warburg, then that means that there's some kind of outside influence. So there's, bacteria, fungus, virus. I sort of throw all of those in a category that I just call bacteria. Pleomorphs, I guess, would be a better term if you're familiar with that. But, all of those guys can live inside of us. Again, they can live inside of a cell. They can live, in fact, inside of organelles inside of cells. They form granules, which are like little seeds, and those seeds will pop and bloom depending on the status of your immune system. So this is looking like, kind of how disease works now. Believe it or not. So it's sort of a new pathology to disease that really has to do with bacteria, bacterial infection, bacterial invasion, and these sort of blooming of these, bacterial fungal kind of things that happen when our immune systems get low. So, how does this relate to diabetes? We'll walk through that. I'm going to do something a little bit different today too. So I'm going to walk you guys through my computer screens here. I've got to get to where I need to go. I know you're seeing what I want you to see, but I need to see it. That way I can drive. Okay, cool. So we're just going to walk through some tabs here, and hopefully you guys can see all of this okay. Looks like you can. That's good news. All right, so if we go to just what is diabetes, if we go to the CDC and we just consider what the CDC thinks diabetes is, so it's a chronic, meaning you don't get better from it, long lasting, that's just frankly not true. But diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Okay. Did you know that? Your body breaks down most of the food you eat into sugar, glucose. That's not true. And releases it into your bloodstream. That's a false statement. So again, if you eat fat, your body's going to break down fat into fuel, and that's your preferred way to run. Glucose is not a preferred way to run, although the CDC would like you to run on glucose because, again, you're a sick monkey if you run on glucose. When your blood sugar goes up, it signals your pancreas to release insulin. That's true. Insulin acts like a key. And again, who am I to judge these statements? I'm a researcher, so I'm happy to substantiate. CDC, if you want to call and have a debate or argument about what you've written here, I'd be happy to do that at any time. I will substantiate what I'm saying with research. I'm sure you will try to do the same, but it won't work because I'm right. Insulin acts like a key to let the blood sugar into your blood cells for use as energy. Kinda. Again, your cells prefer, ideally, if we take a cell, a eukaryotic cell, and say, hey, eukaryotic cell, what do you want to run on? What's your preferred method to run? It's going to say light, first of all, and then it's going to say, oh, well, you're inside of a human. I don't think we can, get you to photosynthesize and everything. What would be your second preferred method to run on? It's going to say fats. It will not say glucose. Okay? It will not say glucose. With diabetes, your body doesn't make enough insulin and can't use it as well as it should. What happens is we eat too much sugar. Your body is awash in sugar. Your cells don't have any problem picking up sugar, picking up glucose, because we eat so many carbohydrates and we eat so much molecular sugar. And when your cells don't have any problem picking it up, what good is it to signal them with insulin to pick up sugar? They don't even need the signaling anymore. That's why they become insulin insensitive, okay? They just don't need it anymore because we've got so much sugar in us. When there isn't enough insulin, our cells stop responding to insulin. Well, that's why, what I just described, too much blood sugar stays in your bloodstream. You're just in sugar. The cells have all they need. Again, it's, you're forcing a metabolic situation on yourself that shouldn't happen. Over time, and this is when it happens, is it's over time. So again, does this happen? This happens to all of us. You eat that piece of cake, or you drink a lot of alcohol. This is going to happen to you, right? Whether you stay in kind of this metabolic state or not, which there's a little bit more to it than that, which we'll get into. Really has to do with repeatability. So again, if you eat a lot of sugar, you're likely to get diabetes. It's just that's a consequence. Okay, well, let's talk about how sugar is metabolized. And again, I think this is important. And it's important to talk about kind of what sugar is. So if I give you a banana, is that sugar? Yes, that's a lot of sugar. If I give you an apple, is that sugar? Yes. If I give you a piece of celery, is that sugar? Yes. But those type of sugars are complex sugars that your body sort of has to work to break down, and your body is more used to dealing with them, and they're not in the concentrations that we get in something like, I don't have an example, but a Heath bar, okay? Or a bowl of Fruit Loops, right? So those sugars, that's more sucrose, and sucrose is a combination between glucose and fructose, okay? So, and this is what this says right here. When you eat sucrose, the glucose and fructose molecules are separated by enzymes in your small intestine before being absorbed into your bloodstream. So again, when we eat molecular sugar, we eat table sugar, CNH pure cane sugar that's in everything. What happens? Well, that gets split apart into glucose, and that's what your body thinks is sugar. That's what insulin has to do with, and diabetes has to do with, is glucose. But it also gets broken down into fructose. Well, what is fructose? And, is fructose sort of bad for us or good for us? We'll talk that through. But they used to think fructose doesn't elevate your A1C in the same manner, let's say, as glucose. So they used to think, oh, well, everybody likes to eat sweet stuff. We'll have you eat more fructose, rather than glucose, and that will help your diabetes status. That doesn't work, okay? That doesn't work at all. Okay, so this is dietary fructose and metabolic syndrome and diabetes. So this is basically the study. This study is saying that, it's kind of looking at if fructose was a better solution than sucrose. And it finds that in some ways that it is, but in some ways it's not. And in particular, fructose disrupts how you process fats. And this is super important. Your body sort of goes through these two metabolic states. And again, I've done lots of podcasts on this, but I'll just quickly describe what happens. This is called fasting and fed. You can think of it as AMPK off or phosphorylated. That's the cellular sort of equivalent. You can think of this as anaerobic versus aerobic. You can think of this in a lot of different ways, but your body wants to go through, your body will do this at a macro and a micro level. So again, if you're burning, if you're running a marathon, you're going to be aerobically sort of doing things in the muscles that you're working, because that's the most efficient way to do things, okay? But at a macro level, what happens is when you eat a meal, so you go into a special metabolic state called fed. And when you're in fed, your body wants to run on glucose, okay? So it wants to use the glucose that we have stored and inside of us and in our food to basically run all of the systems in our body, or as many systems as it can, because what you end up doing is dealing with fat. And fat is very precious to us. So fat is the most precious substance on earth to your human body, other than oxygen and water, right? So fats, dietary fats, are super precious. So when we eat, our bodies go in this special mode and they go, oh, we just ate. We need to optimize the fats. We need to grab them all. We need to look at what's in fat tissue. We need to examine that. We need to see if what this guy just ate is better than that. And if it is, we need to swap stuff out and put it back in fat tissue. And all of that takes 5 hours. Okay. And when you're doing that, that is very energetically expensive, right? It costs you a lot to do that. It costs you a lot to eat. And so when you eat, again, all of these systems kind of go down because you need the energy to be able to do all this fat swapping and all this kind of stuff. And that's why you run on sugar, because that's quicker energy. So that's why we run on glucose, because it's quicker energy. It's not as efficient. And again, God is a perfect engineer. He built you to be a very efficient machine. So it's not very efficient to run on glucose. So your body really doesn't want to be in that state very long. But when you eat, it's got to be in that state for 5 hours. After 5 hours, you flip. What is the flip? It's actually AMPK gets phosphorylated. So that's what happens. And so that begins to happen all over your body. And you begin to run on fat versus sugar. Now, again, you will never lose weight if you don't listen to what I'm saying, because most of us eat every 5 hours, so we never get out of this less efficient state, and this is literally what causes, it looks to be the underlying cause of diabetes. So what is long explanation to really just tell you what fructose does. So what fructose does is it forces you into glucose mode, even if you're trying to get out of it. So let's say you're right at 5 or 6 hours after a meal and you're ready to come out of your fed state into fasting state and start burning fats and beta oxidizing like we should and have our immune system activated and all that happens when all that glorious stuff happens. You got fructose in your liver, ain't happening, baby. You're going to be stuck in diabetic mode. So that is looking to be kind of what fructose does. Again, it's a sweetener. It's in everything. If you eat a lot of ice cream, you eat a lot of fructose. Make your own ice cream at home. That's way better. You can make it with better fats. You can make it with better sweeteners. It just tastes better. It's fun, right? Get out the old ice cream cranker. They make better ones now. So long-term fructose consumption accelerates glycation and several age-related variables in male rats. So again, this happens in humans too, we're assuming. It certainly does happen in rats, or so B. Levy and M.J. Werman found, Mr. Werman and Mr. Levy found that long-term fructose consumption basically will accelerate glycation. So what does that mean? If you get an A1C test, that you'll get for diabetes, if you're getting tested for diabetes, is a measure of how glycated your hemoglobin is. So what this is saying is long-term fructose consumption accelerates the glycation of your hemoglobin. Does that necessarily mean that you have diabetes if you have more glycated hemoglobin? Well, no, because again, it could be related to fructose consumption. So what I'm saying is if you're popping hot on that A1C test, oh my gosh, my A1C is high, it could be you have diabetes. It could also be that you just have eaten too much fructose, okay, over a while. So again, the A1C test is a good indication of risk, but it is not the be-all, end-all that pharma makes it. And just because you pop out on an A1C test, it just means that, a clinician needs to dive further into that and understand your diet and understand your food consumption. And oh, what a novel concept that we need to actually go a step deeper in healthcare with someone, that we need to ask some additional questions other than, you had the test, you pop hot, here's your metformin, here's your insulin, see you later, bye, right? It's a little more to it than that. So, again, most diseases will have some kind of a bacterial genesis that you will find. It's not really hard to prove that to yourself. So you can prove that to yourself the way I have. A couple of Google searches, I think, will take you to where you need to go pretty quickly. But if you start looking at bacteria and diabetes, it does look like diabetes is closely associated with dysregulation of the gut bacteria. And there are some bacteria that in particular do show up quite prevalently. So this guy shows up quite prevalently. So Coperococcus. And again, there are also bacteria, so these guys tend to show up and have a lesser or help with diabetes. And it's really interesting when you look at the gut biome and you sort of, this is what we're able to do with some of the tools that we have here in our clinic, is to be able to look with some accuracy at your gut biome and see what's going on. Well, I've looked at a lot of these studies, let's say, and what happens is, it looks like folks will have kind of a core bacteria, their main bacteria, fungus, or virus, and then they'll have other things that sort of flare around these. You will also have sort of probiotic bacteria that tries to help you. And those are also evident and measurable, in kind of what we measure. So, and I can almost tell how severe something is by how much helpful bacteria, you have indicated on some of our tools. But this is what happens that, in diabetes, so severe diabetes, you've got this guy that's gonna show up quite a bit, right? And so, is he the cause of diabetes? Probably not. It's probably more complicated than that, and there's probably an underlying smaller guy that honestly is probably the cause of diabetes. But this is just showing that this is bacterial related. It has to do with the gut biome. It absolutely, has to do with our bacterial status and our immune status. What I want to show you guys is that fasting and both intermittent fasting and full-on fasting will alter the gut microbiome and will reduce blood pressure and body weight in metabolic syndrome. So again, does this help with diabetes? Well, diabetes is a sort of a part of the metabolic syndrome loop. And this is saying that this helps with two legs of the loop. And so you would assume that it would help with the third leg of the loop, which is diabetes. And it turns out that it does. Let's see if I can get to the conclusion here real quick. So anyway, this study's conclusion: fasting can prolong survival and reduce disease burden in rodent models and possibly in humans. In contrast, today's Western diet promotes your Western diet that you're eating, my Western diet that I'm eating, promotes cardiometabolic disease. Wow, that's a big word. So our diet promotes it. Why does our diet promote it? Sugar and the wrong kind of fats. Exactly, what we preach here, right? So how diet affects the gut microbiota, immune system, and subsequently host pathophysiology is not fully understood. We understand it pretty well. And information, these guys didn't. That's why they did the study, so they got to say that, right? And information is lacking on how periodic fasting affects the gut microbiome in patients with metabolic syndrome. To reduce cardiometabolic disease risk, exercise and a healthy diet are often prescribed. Shifting from a Western diet to a healthier Mediterranean-like DASH diet, meaning up your monounsaturated fats, up your omega-3 fatty acids, pay attention to what aminos you're eating, and cut back on the sugar. To achieve optimal nutrition and negative energy balance is recommended, although compliance is a major hurdle. So again, your health is in your hands. It's one pill won't save you. Compliance is a major hurdle. Our study is the first of its kind to investigate the effects of a lifestyle modification in combination with fasting therapy in patients with metabolic syndrome using a multi-omics approach by combining gut microbiome analysis and deep immunophenotyping. The Western diet is known to induce metabolic inflammation, accelerating cardiometabolic disease. The gut microbiota is a delicate ecosystem that plays a pivotal role in health and disease. Why is it delicate? Because it's ever-changing. It's ever-changing around your diet. It's controlled by the endocannabinoid system. Isn't that cool? Dysbiosis has been observed as a characteristic of several inflammatory, cardiovascular, and metabolic disorders, for instance, obesity, including hypertension. The healthy gut microbiome is relatively stable, although various factors such as antibiotics, intestinal infections, and profound dietary lifestyle changes, such as moving on or off a Western diet, they're telling you the Western diet is killing you. This is what this study is saying, very obviously, okay? Anyway, let's go down there to some conclusions. So here we study the role of fasting in cardiovascular risk patients with metabolic syndrome. 5 days of fasting followed by 3 months of a modified DASH diet induced distinct microbiome and immunome changes not seen under DASH alone, as well as sustained SBP benefits. I don't know what SBP means. Anyway, whatever SBP means, benefits for 3 months post-intervention. Applying machine learning algorithms, we were able to make effective predictions regarding which patients would respond positively to treatment via blood pressure reduction from either baseline immunome or 16S microbiome data. So anyway, these guys all got better. I mean, that's the long and the short of the study. When they intermittent fasted, and they were able to change their microbiome, which they measured. Isn't that cool? Okay, intermittent fasting, the positive news continues. So here we are with this article on intermittent fasting. It can help weight loss. It can be hard, but maybe it doesn't have to be. It's not hard. You've got to just sort of retrain your body, right? So what happens in intermittent fasting, like Cindy and I have been intermittent fasting for 2 years, all right? It's happening to me right now. Right now I feel hungry. I feel hungry every morning at like 10, 9:30, 10, 10:30. Especially if she starts making food out there for people, I start smelling things. So that even makes me feel more hungry. Well, I'm not hungry. You can go 40 days without food. I ate a big meal last night. I'm not hungry. I don't need nutrients. That's not what's going on. I've just trained myself. I'm kind of having gas and stuff. And so that feels to me like hunger, but it's not hunger. Anyway, you've got to sort of train yourself through this. You know, if I was really, really hungry, I'd take a tablespoon of olive oil. That really will sort of tell your body, okay, you're not going to die. You could go 40 days without eating. So there's lots of little tricks to fasting. And that, again, that's what we do here. We help you with that. We will coach you through that. We'll coach you through anything, really. But we coach you through intermittent fasting, and because we preach this so hard, okay, because it's so important to your health, intermittent fasting. You can go look out there and just, satisfy yourself to the amount of information out there about intermittent fasting. And again, why is it important? This whole AMPK, fasting fed, your metabolic state, your immune system, all that, you're better off in a fasting state. And so the more that you can go without eating, and still stay alive and nutrient your body, that's what we really need to look at in the future. I mean, this will be a prescription for you in the future. Go as long as you can without eating. Make sure you're getting the right nutrients when you eat, because that will help you with your disease state more than anything else, honestly. Certainly more than, here, take this metformin pill. If you don't change the behavior that got you in the position that you're in, then the position that you're in will not change. And it's just kind of that simple. But it's pretty easy to change the situation. We unknowingly and kind of unwittingly, if any of us were educated about all this, we wouldn't eat the way that we eat. If we sort of grew up with this knowledge and, right off the bat, we were taught how to eat the proper stuff and kind of we were given the proper stuff to eat, we would live a lot longer. First of all, we'd all live to be, maybe Moses level old. But we wouldn't even have this discussion. I mean, you wouldn't have disease like we do now. So it's, our food supply and our food system is killing us. You can go down whatever rabbit hole you want with that information, but, most food rolls up to what, 4 or 5 companies, and they're kind of the same companies that most pharma roll up to. So do with that what you will, but that is some truth for you. So palmitic and oleic acids, the yin and the yang of fatty acids in type 2 diabetes mellitus. I never can say, I'm not sure how to pronounce that. I always could just type 2 diabetes, right? So palmitic is going to promote diabetes. It's a saturated fat. It's in a lot of things. Oleic acid is going to demote diabetes. So just, let's say you chip, but, intermittent fasting, I don't want to do that. I don't want to take supplements. I don't want to do anything. I just want to do my one pill. Well, here's your one pill. And again, will it work? It will help. I don't know if it'll work by itself. Oleic acid, olive oil, blip, blip. So that's what oleic acid is. Oleic acid is in olive oil. Did you know in about 1900 they controlled the amount of oleic acid that goes in olive oil? I found that fascinating. So they set it at 15%. Just tells you kind of how probably important oleic acid is. And, there was no health reason to do that. Oleic acid is super good for you. Oleic acid builds an endocannabinoid called oleomide, okay? So if you're familiar with the endocannabinoid system, oleomide, super important guy in our endocannabinoid system, arguably more pathway important than anandamide, which looks to be our main guy in the endocannabinoid system. So oleic acid, super important in our endocannabinoid system, and also has to do with sort of hunger satiation, understanding sort of that we're full, I guess, and also understanding sort of this diabetes situation that can happen if we eat really too much sugar. I mean, that's all, or drink too much alcohol, consume too much sugar. Okay, so this is some good pictures in this. It's always good to, have some pretty pictures in what we're doing. But metabolic pathways of the Warburg effect in health and disease, perspectives of choice, chance, or chain or chance. So this is Jorge Burns and Jean Amanda. So what is the Warburg effect? So the Warburg effect is what happens in cancer. And the reason that this paper exists is they were looking at, this also sort of begins to happen cellularly when you're in space. So your cells sort of begin to flip to Warburg, which is cancer promoting and disease promoting. So this paper is sort of about that and talks about that in the sort of context of space exploration, which is interesting, but it does a good job of explaining what the Warburg effect is and its role in disease. So this is normal. This picture is normal cellular function. This is what normal cellular function looks like with glucose. Okay, so it doesn't look this way with fats. It looks a little bit different with fats. But when a cell is trying to run on glucose, so let's say you've just eaten a meal, whoop, all your cells are, for the most part, are going to be wanting to run on glucose because you're going to be wanting to deal with the fats over there. So this is sort of what it looks like. And this is a 1 to 2 exercise. So 1 unit of glucose into this cell that's coming in through this GLUT receptor will produce 2 units of ATP that's happening up here, or sort of all through the process. But this is a sort of your cellular respiration process and how your cells produce energy. This is the least efficient way to produce energy. Now, what happens in cancer and what happens in disease, a lot of disease, and this is looking like it happens in bacterial disease. This is looking like kind of what happens in the bacterial hijack. This is what the bacterial hijack looks like, is Warburg. But you'll see that, again, now these cells are not just taking in glucose, they're also taking in some, where are they, amino acids. They're pulling in other things. So they're running on other things other than just glucose. They are completely changing their signaling molecules. So they're pushing the PI3K button. They're pushing the mTOR button. So they're pushing those sort of cellular nutrient status buttons. And they're also pushing the growth buttons over here with HIF1A. And so all of this is sort of how a cell gets hijacked under cancer or under disease states. Now, interestingly, the study goes on to talk about diabetes, because this happens in diabetes. So this is glutamine metabolism. So this is another thing that happens in this bacterial hijack. And this is what happens. This is part of the pathology, let's say, of autism, okay? Autism is characterized by neuroexcitement, so too much stuff going on in the brain. Well, what causes that? Something called glutamate that's right here. And so what happens in this bacterial hijack is glutamine, which is our most prevalent amino acid, gets hijacked, and it gets pulled into cells, and it gets made into glutamate. And then glutamate is made through alpha ketoglutarate into basically glucose, okay? And so this is a way that cells in this, and they get stuck in Warburg, which is very efficient. So they have to use more fuel. So glucose is not a sufficient fuel anymore. So they have to kind of convert other stuff to glucose. And at the core, a cell has to use glucose, but it's converting other fuels, let's say, to glucose, including branched chain amino acids and including glutamine, which is fascinating. Let's see how. This is a very good paper, by the way. So, and you can find this stuff really easy, Warburg and diabetes. And Warburg is primarily, it sort of was discovered in cancerous cells, and so it's associated with cancer, but it's also associated with lots of diseases, and diseases mostly that I would say are associated with a bacterial infection, virus, fungus, because that's what these guys do. That's how they hijack cells. That's how they set up a little home inside of you. So here's lessons from type 2 diabetes, from a Warburg effect through normal cell metabolic choice. So it is addressing this as part of, type 2 diabetes and diabetes as part of this Warburg syndrome, which is important. So, and it's a tell. Again, Warburg effect in aging, and I would argue that aging is really associated with this Warburg effect. So, metabolic reprogramming of host cells upon bacterial infection. Why shift to Warburg-like metabolism? The finding that Warburg effect observed in proliferating cancer cells is also observed during immune response, and it is. So your cells, when they have to rapidly proliferate, will switch to this Warburg because it's advantageous, but they never stay there very long. So your immune cells will do this. A lot of cells will do this, but what happens, it looks like, is if they're infected, they'll get stuck that way, and that is a sort of a hijacked or cancerous or infected cell, however you want to look at it. So the finding that the Warburg effect observed in proliferating cancer cells is also observed during the immune response renewed the interest in the study of metabolic reprogramming of immune cells, a field of investigation called immunometabolism. However, the specific mechanisms and processes underlying metabolic changes of host cells upon bacterial infection remain poorly understood. Several recent reports have reported that mammalian cells infected with intracellular bacteria have an altered metabolism that resembles the Warburg effect, exactly what Chip has been saying. They've been bacterially hijacked, seen in cancer cells. In this review, we will summarize current knowledge on metabolic reprogramming and discuss putative causes underlying the preferential remodeling of host cells to Warburg-like metabolic programs during infection by intercellular bacteria. I'll spare you that, but the big thing is, it's just, this is established, right? That this happens, bacteria cause this change. This change is associated with diabetes. This change is associated with cancer. This change is associated with autism. This change is associated with a lot of major disease states. And again, this is just further on that study. So that's about all I got for you today, boys and girls. The big thing, the big takeaways, I guess I didn't really do a summary sheet. So if you have diabetes or type 2 diabetes, there is no question, and this is well indicated in the literature, that intermittent fasting will help you. In fact, it's also indicated in the literature that intermittent fasting will cause a remission, or could cause a remission, in your diabetes if you combine intermittent fasting with good dietary practice. Isn't that cool? So you've been told all your life you need to take medication. You've been told all your life that you need to take insulin, and there may be a way out of that loop. I would suggest that if you are an insulin-dependent diabetic, certainly if you have neuropathy, if you're severe, let's say diabetic, and you're getting ready to try this, you do it with some measurement and management, meaning, it doesn't have to be me, but find someone like me that's going to help manage you through this situation, because you can get yourself in trouble. Like if you start fasting and you're still eating a lot of sugar, that's going to really, really hurt you. So you have to do this sort of in combination with some changes, to your diet and things like that. And again, there's, we have lots of tricks to help you. There's lots of sweet stuff, you can still eat. And, stevia actually is kind of a good thing if you have diabetes. So if you like stevia or the sweetness of stevia, that will help you, which is great. So anyway, there's a protocol, I guess is the best way to say it. And so, we have a protocol that we would put you on if you're a diabetic patient at the hospital, and we would use that protocol to move you, from that situation. And we have ways to measure this, which is really cool, to show you whether your, situation is getting better or not. They're non-medical ways. And again, if you're getting worse, I'm going to send you to the hospital. But there are ways that we can show you through neuropathy, really the temperature of your feet, how you're coming out of a diabetic situation or getting into one, actually. So anyway, if you want any of that, come see us here at the clinic, Neighborhood Nutrition and Clinic, Neighborly nutritionandclinic.com. I think that's what it is. Neighborly Nutrition. It's neighborlynutrition.com. Or you can find our products at truemedics.com. All that stuff that'll be in the stuff at the bottom of the video. So anyway, thank you guys. Love you guys. Stay healthy. Hopefully you find this useful. Let's beat diabetes. Let's beat cancer. Let's beat autism. Let's beat these bugs. Let's beat this bacteria. Let's get